Hello and namaste. Today we'll talk about the scope of treatment in uterine fibroids or the fibroids of the uterus using homeopathy. Uterine fibroid is very common and it is said to affect wide range of people varying from 20% to 70% in different parts of the world, especially during the reproductive years in females. My name is Dr. Rajesh Shah. I am a medically trained homeopath and the director of Life Force, where we treat patients from all across the world. My experience shared here is on the basis of the treatment documented with around 100 plus cases of uterine fibroids. Uterine fibroids in females is a common occurrence and it is governed largely by hormonal changes as well as certain genetic factors. In my experience, every case of uterine fibroid does not require a surgical removal. Uterine fibroid could remain during the reproductive years and they may regress even spontaneously after the age of 45 years in many females, if not in all. When uterine fibroids gives certain symptoms such as heavy bleeding or protracted or prolonged bleeding for a few days, in particular, they require attention and some medication. Homeopathy has a role to play in the treatment of uterine fibroids, especially by controlling its symptoms. The bleeding, if heavy, could be reduced significantly using homeopathy. If the bleeding, which is lasting for many days, could also be reduced and shortened using homeopathic medicine. Homeopathic medicine can also reduce the size of the uterus to a certain extent. Please do not expect all the uterine fibroids to resolve completely, disappear the large tumors and reduce them to no tumors at all. That is not what is expected after using homeopathic medicine. If homeopathic medicine can reduce the symptoms, reduce the bleeding, and then with the natural process by 45 or 50 years, it is likely that the uterine fibroids might reduce in size and without giving any trouble. So every tumor of the uterine fibroid may not really require a removal of the uterus, which is unfortunately practiced in many parts of the world. Homeopathy has a definite role, as I explained, and it is strongly recommended in most of the cases of uterine fibroid. However, there may be some cases where the bleeding is continued and not just responding to homeopathy or any other medicine. These are the cases we have to think about alternative treatment with some hormones, or some cases may require surgical removal, but not all. The treatment duration takes time because this is a surgical condition. It is a tumor, it's an overgrowth. So the treatment may be continued for 6 months to maybe about 2 years, depending on various factors belonging to the patients. So I hope this video helps to get some idea about the scope of homeopathy or the prognosis in the treatment of uterine fibroids. Thank you so much.